I sleep just fine. I have no problem sleeping. These are classic statements of people that don't know they have sleep apnea. Hi, my name is Dr. Michael Mattice from Vero Beach, Florida, and today we're going to talk about obstructive sleep apnea. Obstructive sleep apnea is the only known medical cause of high blood pressure. There are 5 rare surgical causes. The vast majority of patients are not aware that when they sleep, they stop breathing. It doesn't matter if you're overweight or thin, this family genetic disorder occurs whether you snore or not. If you snore, your spouse may notice that in the middle of a snore you stop snoring for 60 to 90 seconds, then return to snoring. That period of time is when you're not breathing. It's very common when one sleeps on their back. This occurs because the jaw relaxes and gravity causes the jaw and tongue to fall backwards and partially obstruct the airway in the throat. The question in apnea is how many times an hour and how low does your oxygen saturation get in your blood? At 90%, we need to be given oxygen. The standard treatment is to use a CPAP device that provides continuous positive airway pressure, CPAP. And your lungs are constantly inflated with room air, 21% oxygen. Some people can be helped with a mandibular device that keeps the jaw forward, but it is critical that one gets a repeat sleep study to be certain this device prevents the apnea. It's described as mild, moderate, or severe apnea. It really makes no difference. As I state, you're pregnant, not just a little bit pregnant. Treating this problem, if you have it, is critical to every organ of your body, but is also a primary cause of dementia. I've seen many people's dementia improve over time because they treat this disease. There are objective ways to document this. We monitor the process by getting a CPAP compliance report that tells us many things, not just how often or how long you use it. We check to make sure the pressures are preventing any apnea and whether the device is leaking on your face. The different types of masks should be replaced every 3 months, and your insurance carrier typically pays for that. There's 26 different forms of apnea. Depending upon the severity of the apnea, the patient notices they wake up in the morning not feeling refreshed, and they can be sleepy during the day. I have proved over 5,000 times not treating one's apnea will keep their blood pressure from staying normal. I will discuss more about high blood pressure in another video. I did sleep medicine for 3 years and have noticed that insurance providers are now changing what they do. The patient used to get 3 consecutive home sleep studies because each night is different. Now, when you get a home sleep study, you only get 1. Getting a sleep lab study is best, but even then, central apnea is frequently missed. This is one of the worst forms of apnea and commonly seen in congestive heart failure and other comorbid diseases. It is very important to rule out sleep apnea as a root cause of arterial vascular inflammation. It definitely affects the quality of your aging. If you're concerned and would like to learn more about obstructive sleep apnea, we would love to invite you for a free consultation. You can also read the book Healthy Heart, Healthy Brain by Brad Bale and Amy Doneen to learn more about this. Thank you for watching, and see you on the next video.